We are your teachers, and in these past decades, the United States has been struggling to regain control of the opioid epidemic. Along with the COVID-19 pandemic, opioids and fentanyl have rapidly been seeping into our communities. According to the CDC, in 2020, California has become the leading state with the highest drug overdose deaths, 8,908 out of the whole nation. We are going to start off today's lesson with a short video. Then we will discuss opioids, the effects they have on the body, the difference between prescription and illegal opioids, the impact they have on communities, and how to identify a possible overdose situation. Most importantly, we are going to discuss about Narcan, a nasal spray medication, and how it is used to reverse an opioid overdose. Afterwards, we will spend some time going over that basic information before we break out into groups and demonstrate how to use Narcan nasal spray during an overdose situation. You will then have time in your groups to practice what we just demonstrated before each student runs through the demonstration with one of us watching so we can check for any mistakes and correct them. You will be leaving with a handout that will be due the beginning of next class. So I'm going to be showing a video on a real life opioid overdose.
We got a report from a citizen. He saw a white male in a black vehicle slumped over like he was OD'd or something. We're going to go and investigate. That's what we're doing. Hey, right there. Yeah. I thought you were going to get the beat easy. He is breathing. Get him out. Wait, hold on. Okay. Got him? Yep. Anyone know him?
No, I was at the light and I just seen the news report.
It's on. Positive. That ain't the fire marshal. We need a medic unit to Grand and Cross Street at the intersection. We're working on it. Hey, bud. Hey. Hey, what's going on, man? Take a breath. Take a deep breath. I'll be right back. There you go. Hey, take a breath. Big breath. You all right, man? Sit down. We'll help you out, okay? We're the fire department, okay? We just give you some medicine if you're overdosing, okay? Take a big breath. There you go. We noticed that, weren't sure if he was breathing or not. We made entry into the vehicle using the captain's tool, pulled him out, and resuscitated him. Used a big valve mask, gave him supplemental oxygen, and then we used a Narcan on him. A lot of times the car is unlocked, but if we need to break the window, if we're not sure if the person's breathing, we'll do anything necessary to gain entry. He's breathing now, he's talking now. Medic Unit 9 arrived, and they're going to transport him to the hospital.
I wanted to ask you guys about your thoughts after watching this video. So how did this situation make you feel? What were the symptoms that the man was experiencing? If you were in that certain situation, what would be the first step you take? And what signs would make you think that this is an overdose?
So now we will begin our lesson on opioids. So what is an opioid? Okay, hold on. An opioid is a broad class of drugs that act on opioid receptors primarily used to provide pain relief. They are commonly found in opioid poppy plants and can be synthetically made as well. How are they administered? They can be administered in many different ways, such as orally by pill or liquid form, nasal spray, skin patch, sublingual tablet, which is dissolvable, intravenous or intramuscular injection, as well as being inhaled from being smoked or snorted. Once administered, opioids attach themselves to opioid pain receptors found in the brain, spinal cord, and the body. They block signals of pain from the body through the spinal cord and to the brain. They effectively reduce the feeling of pain. Quick recap. Amongst your groups, answer these questions. What is an opioid? What is their primary function? What are the routes of administration? What happens to your body if you take one? And do you know the names of any opioids? Classifications of opioids, which are prescription versus illegal. Opioids are primarily used to treat moderate to severe pain and are commonly prescribed after surgery, injury, and for cancer patients. The most commonly prescribed opioids are fentanyl, oxycodone, hydrocodone, oxymorphone, and morphine. Opioids based as prescription drugs often enter the community through providers, patients, robbery, theft of pharmacies, and false prescriptions. Once in the wrong hands, they become illegal drugs that are commonly mixed with other drugs. People who use opioids may look for stronger forms of the substance, such as fentanyl mixed with AKA, cocaine with heroin, methamphetamine, oxycodone, and heroin. Now, amongst your groups again, can you differentiate each type of drug shown?
Thank you, Antonio. So why, classmates, why are opioids dangerous? Well, the effects of an opioid are great at relieving pain and are generally safe when you take them for a short period of time. But if misused, they can become problematic. If you take opioids in small amounts, they can make a person feel relaxed, happy, feel some social feeling of pleasure. However, the recurring feeling of pleasure can make a person crave or yearn to experience this feeling, which may lead to misuse, abuse, and addiction. Now, class, we're going to differentiate addiction, the misuse, and the abuse. Well, addiction is opioid addiction that is characterized by a powerful, compulsive urge for opiate drugs, even when they're no longer medically required. Opioids change the chemistry of the brain, which leads to drug tolerance. And over time, you're probably going to need more of that dose to achieve that same level of effect. Now, the long use of opioids creates that opioid dependence. Opioid addiction can lead to life-threatening health problems. For example, the inability to control cravings, changes in sleeping patterns, weight loss, isolation from families and friends, and you can end up stealing to obtain these types of substances. Now, misuse means that you're not taking the medication as according to your provider's instructions, and some people may be using them to get high, or maybe taking someone else's prescribed medication. Now, abuse is that behavior that starts to become a pattern, and that causes a significant problem in someone's life. This is also recognized as a medical brain disorder, which refers to the abuse of illegal and prescription substances. Now, the social implications of drug use in our society, some of the effects that drugs have on individuals who live in our society. Drugs increase criminal activity, they increase homelessness, they thus a cascade of events where people lose their house, they become financially unstable, and 38% of homeless people were dependent on alcohol, but 26 also abuse other types of drugs. With all those all those factors affecting an individual, they lose their employment, they lose their income, and that increases emotional and mental disorders like anxiety, depression, the general behavioral issues. That also creates social isolation among your communities. However, though, important for you guys to know is that drug use and addiction are preventable. Now, opioid overdose is basically the opioids affecting a part of the brain that regulates breathing. So when people take high amounts or a high powerful dosage of an opioid, that can lead to an overdose, which may slow down your breathing and actually make you stop breathing overall. And that may lead to death. Now, the causes of an opioid overdose are when people are taking opioids to get high, they take an extra dose, or they take it too often. Sometimes it's unintentional and sometimes it's accidental. Sometimes they mix opioids with other types of medication, other types of street drugs, or alcohol. And children may accidentally take these opioids. Someone can leave their opioids and a little child can reach it, think it's candy, and accidentally take an opioid. Now, opioid overdoses, when you're in that situation, what are the signs to an opioid overdose? Well, when you come across a patient, usually their face is extremely pale, they feel cold, they feel clammy to the touch, a person's usually limp, their fingernails and their lips turn blue, they start to vomit or they start to make gurgling noises. They can't be awakened, they're unable to speak, very unresponsive, and their breathing starts to diminish and their heart rate drops or completely stops. So what do you do if a person is having an overdose? Well, first step is you look for symptoms. You check if the person is unresponsive, if they are unconscious, if they're having shallow, slow breathing, they're gasping, snoring, or they're not breathing. If they have blue lips, blue fingertips, they're cold to the touch. If you find these symptoms, then you call 911. You give the operator your exact location, and if there's any medication surrounding the victim, then you can give them the description of the medications. Now, if applicable, you can administer naloxone or Narcan, and then you stay with the individual until further EMS arrives. You move the person onto their side, and you begin CPR only if you don't see them breathing anymore and if you don't feel the pulse. But we'll cover more of that in detail in our further presentation here. Now, what is naloxone, Narcan? Narcan is a medication approved by the FDA to rapidly reverse the effects of an opioid overdose. Now, who may be at high risk for the usage of naloxone are the people who are taking high doses of an opioid for a long term, especially to manage chronic illnesses and chronic pain. And then those who are receiving a rotating opioid regimen, and those who have been to the ER, they got discharged following an opioid overdose, and those who take a really powerful opioid that's long acting, and other people who have gone to jail, state abstinence, and then they got released, and those are ones that are highly risk for relapsing. Now, how does Narcan work? Well, Narcan is an opioid antagonist, meaning that it binds to the opioid receptor, reverses and blocks the effects of other opioids, such as heroin, morphine, oxycodone. The recommended dose of Narcan is 1 spray into 1 nostril, given once every 2 to 3 minutes. Now, you can give Narcan to any age group. You can purchase Narcan, which is extremely cool, out at your nearby pharmacy, such as CVS. Now, class, I'm going to leave you with some final thoughts. Now, go ahead and read through these questions here and then answer them among your group. And then for a group discussion, look at this prompt here and, let's dive a little deep to see how opioids are affecting our community here in Long Beach. My colleague is muted. Sorry, class.
Okay, students, we're going to get started with the demonstration. So please get into your groups of 4 that we assigned at the beginning of class while I get the PowerPoint up. Each group should have a dummy, prop Narcan, nasal spray, and a pamphlet. If you are missing any of those, please let us know. Reversing opioid overdose. Like described earlier, signs of a possible overdose include unresponsive to touch or voice, slow, uneven breathing or no breathing at all, snoring, gasping, or gurgling, and the fingernails or lips are blue or purple. Checking for a response, call the person's name and shake their shoulders. If this doesn't work, vigorously grind the knuckles into the sternum, which is the breastbone in the middle of the chest, and rub knuckles on the person's upper lip. We saw this in the YouTube video that we first watched. So step 1 of administering Narcan is going to be to call 911. If there is another person with you, have them call 911 while you start administering the Narcan. Take the Narcan nasal spray out of the box and peel back the tab. It is important that you do not remove the spray until you are ready to use it, and please do not test the device. Hold with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Tilt the person's head back before administering the Narcan to provide support under the neck with your hand. Gently insert the tip of the nozzle into the nostril until your finger touches the bottom of the person's nose. Press the plunger firmly to administer the Narcan, and then remove from the nostril after giving the dose. Wait and watch the person closely. If they do not respond within 2 minutes, give the second dose of Narcan nasal spray in the person's other nostril and place them in the recovery position. This is because usually when those who have suffered an overdose with opioids come to, they throw up, and we want to avoid them aspirating. Are there any questions on what we just demonstrated? If not, we can begin having your groups practice. Once each person feels comfortable, let one of us teachers know so that we can check off your group. Remember, all students must participate.
I will be asking you guys some questions. Okay, so this concludes our lesson for today. We discussed opioids, the effects they have on the body, the difference between prescription and illegal opioids, the impact they have on the community, and we went through how to identify a possible overdose. You then administered Narcan in an overdose scenario. So I want you guys to provide feedback on the following questions that I'm going to ask. So how are your overall feelings towards today's lessons? Did your thoughts change on how you would approach an overdose? What stood out to you the most? So I want to have a student volunteer to demonstrate the steps for administering Narcan. And then I'm going to ask a student to come up with a situation that involves an overdose and how he or she would approach it.
Okay. On your way out, be sure to pick up one of these worksheets. As you can see, the steps of administering Narcan are in incorrect order. Please correct this by labeling, by numbering each step according to the order in which you would administer Narcan. Underneath, you will see step 1 through 6. And here you are to fill out what is occurring at each step. This will be graded and due at the beginning of next class. If you have any questions, please write them on the back of your homework and we can have a discussion when we see each other next.